This is an extract from the Leader podcast by the Evening Standard, hosted by me, David Marsland. To hear the whole thing, search for us on your podcast provider. Some experts had been predicting it for a while. Now the Office for National Statistics has made it fact. Britain suffered the worst excess death rate in the whole of Western Europe during the coronavirus pandemic. England tops the table with a death rate 7.55% above normal. That's higher than Spain's 6.65 increased rate. Scotland's third on the list with a 5.11 difference. Before the figures were announced, the government revealed it would be extending the length of time that people with coronavirus symptoms will have to self-isolate from 7 to 10 days. Speaking to LBC, Health Secretary Matt Hancock said it followed developments in scientific understanding of the virus and how long it remains infectious.
Where the science changes and we learn more, so we will change the policy. And the challenge is that for how long do you need somebody who has tested positive, so we know has got the virus, because of course if you get symptoms then you should immediately get a test. How long should they isolate for? And this is essentially a clinical decision.
Well, our political editor Joe Murphy is here, and Joe, we'd expected the rules on self-isolation to change for a few days. Why is it happening now?
The reasoning is that there is a low but tangible, to use the phrase of one of the senior health and medical officers, a low but tangible possibility that you may still be infectious between 7 to 9 days after the onset of the illness. That would be after you notice symptoms. And our understanding is there's no specific trigger that caused this policy change, except the chief medical officers, who include Chris Whitty and Jonathan Van Tam, wanted to do this now because at the moment we are sort of between the waves. The prevalence of the disease is low, and if there is going to be a second spike, they want to get ready for it.
How worried are they about this second spike? Boris Johnson's spoken about it. When are they expecting it?
Well, it's interesting, isn't it? We've had, over the last few days, a steady increase in the sort of grimness of the warnings from ministers, climaxing today in a very Churchillian phrase from Matt Hancock, the Health Secretary, who says, "I see a second wave rolling across Europe and we have to protect our shores from it." I've got to say that David Nabarro, who's the World Health Organization envoy on this, says it's not a second wave we're seeing in Europe, it's a recurrence, or it's a sort of some spikes remaining from the first wave. And there is, among some circles, some scepticism, I have to say, that things are quite as threatening in Europe as they seem. We've had Chris Bryant today telling us that he thinks Matt Hancock is slightly exaggerating the second wave threat, perhaps to distract from the other big story today, which was figures from the ONS showing that we've had the highest excess deaths rate anywhere in Europe.
I was going to bring those up, and I wonder how places like Spain, which are on the quarantine list, are going to take that kind of news, Joe.
I think there'll be a bit of a hollow laugh from Spain, because they do feel badly treated by Britain. I have to say that it's very difficult a lot of people have criticised the government for being too slow to act back in March and early April when lockdown was imposed finally. It's hard now to say, well, why are they being too fast to act? And I think ministers could pretty robustly say to the public, look, you want to be kept safe, so this is what we're doing. But of course, Madrid would point out that its islands really have very much lower rates than many parts of Britain. In fact, a lot of British people would be safer on Lanzarote than they would in Liverpool.